Welcome to MTM's Fraud, Waste, and Abuse and HIPAA training. We will begin with fraud, waste, and abuse. The Centers for Medicare and Medicaid Services, or CMS, handed down new rules regarding fraud, waste, and abuse that must be followed by MTM, first tier, downstream, and related entities. This includes transportation providers, drivers, and office staff. This training is required by CMS and MTM's clients. We are all responsible for preventing fraud, waste, and abuse and reporting suspected cases without fear of reprisal. This training will give you basic information necessary to understand what fraud, waste, and abuse is and what your obligations are if you suspect it is happening. By knowing the basics of fraud, waste, and abuse, we are in compliance with CMS and MTM's client requirements, as well as help reduce potential for future fraud, waste, and abuse. By looking out for fraud, waste, and abuse, we protect federal funding given to Medicaid and Medicare programs for non-emergent medical transportation. Today's topics for fraud, waste, and abuse include fraud, waste, and abuse definitions, why MTM conducts the fraud, waste, and abuse training, applicable federal laws, fraud, waste, and abuse obligations, examples of member fraud, waste, and abuse and what to do when member fraud, waste, and abuse is suspected, examples of first tier, downstream, and related entity fraud, waste, and abuse, including what to do when first tier, downstream, or related entity fraud, waste, and abuse is suspected, who is responsible for identifying fraud, waste, and abuse, who is responsible for monitoring fraud, waste, and abuse and auditing at MTM, preventing fraud, waste, and abuse, reporting fraud, waste, and abuse, and protection for whistleblowers. What is fraud? Fraud is an intentional deception or misrepresentation made by a person with knowledge that deception could result in unauthorized benefit to himself or another person. It includes any act that constitutes fraud under applicable state and federal law. What is waste? Waste is overutilization of services or other practices that result in unnecessary costs. It is generally not caused by criminally negligent actions, but rather a misuse of resources. What is abuse? Provider practices that are inconsistent with sound fiscal, business, or medical practices and result in one of the following: unnecessary costs to Medicaid or Medicare program, reimbursement for unnecessary services or services that fail to meet professionally recognized standards for health care. It includes covered member practices that result in unnecessary costs. The importance of fraud, waste, and abuse training. MTM does business with Medicaid and Medicare clients. These clients are required by CMS to conduct fraud, waste, and abuse training with first tier, downstream, and related entities, such as contractors, subcontractors. MTM must do the same with our first tier, downstream, and related entities. This includes transportation providers, drivers, and office staff. In short, because MTM's clients are regulated by CMS, so is MTM and our subcontractors. Documentation of annual fraud, waste, and abuse must be maintained and available to CMS and clients whenever requested. Fraud, waste, and abuse training requirements. They include applicable laws and regulations by both federal and state specific, obligations to have policies and procedures in place to address fraud, waste, and abuse, types of member fraud, waste, and abuse and possible resolutions, types of subcontractor fraud, waste, and abuse and possible resolutions, process for reporting suspected fraud, waste, and abuse, and protection for employees who report fraud, waste, and abuse. Applicable laws and regulations that apply for fraud, waste, and abuse include the False Claims Act. This is 31 U.S.C. 3729, the Stark Law, the Anti-Kickback Statute, suspected marketing violations including inducements, acts defined in 18 U.S.C. Chapter 47, especially 1001 and 1035. The Health Insurance Portability and Accountability Act, or HIPAA, state-specific laws and regulations that address Medicaid and Medicare fraud, waste, and abuse. Your obligations for fraud, waste, and abuse, they include that you should have policies and procedures in place, comply with all policies and procedures developed and amended by MTM relative to fraud, waste, and abuse, acknowledge that payments made to you consist of federal and state funding. You can and will be held civilly and or criminally liable for non-performance, misrepresentation, or fraud, waste, and abuse of services rendered by MTM and its clients. And finally, you also want to immediately refer all suspected or confirmed fraud, waste, and abuse to MTM. All right. Now on the screen here, we've got a few examples of member fraud, waste, and abuse. They include the fact that member changing, forging, or altering any of these items, including prescriptions, that's fraud, waste, and abuse. Lending an insurance card to another person, identity theft, using NEMT or non-emergent medical transportation for non-medical services, misrepresentation of an eligibility status, resale of medication to anyone else, medication stockpiling, and doctor shopping. Possible resolutions for member fraud, waste, and abuse include a note added to the member's file advising MTM of future trips, add the member's name to a list of frequent abusers. The result of that trips request will be monitored and managed to prevent any future fraud, waste, and abuse. We will also report the designated state or county or Medicaid office or MTM client the fact that this member has a report of fraud, waste, and abuse. Now we have examples of provider, transportation company fraud, waste, and abuse. They include falsifying credentials, billing for services not rendered, inappropriate billing, double billing, upcoding or unbundling, collusion, falsifying information submitted through prior authorization or other mechanism to justify coverage. Resolutions for provider fraud, waste, and abuse include recover the trip cost, provider education, make a recommendation for an audit of trip records, establish a corrective action plan, disciplinary action, or even up to dismissal from MTM network of transportation providers. Who's responsible for identifying fraud, waste, and abuse? Basically, we all are, from MTM employees to our board of directors, to the transportation companies, to their drivers, and their office staff. At MTM, we have a designated compliance auditor who monitors the fraud, waste, and abuse. So as these cases are reported to our quality management department, our compliance auditor investigates each of these reported incidents and notes the results of the investigation in the member's file. The fraud, waste, and abuse reported against first-tier, downstream, or related entities is handled in the same manner. And MTM reports these incidents of fraud, waste, and abuse to our clients on a monthly basis. Preventing fraud, waste, and abuse. It is definitely critical that we prevent this fraud, waste, and abuse before it happens. Fraud, waste, and abuse downstream and related entities, as it relates to MTM writers, should report incidents of fraud, waste, and abuse they suspect to MTM's Quality Management Department just as quickly as possible. When preventing fraud, waste, and abuse, our MTM staff very diligent and watch carefully for signs of fraud, waste, and abuse. We deny a trip if it seems suspect. We push trip requests up internal chain of command to team lead. We would contact client and get their guidance and report any suspicious activity to Quality Management Department for investigation. When reporting it to MTM's Quality Management Department, we have a special line for you. That number is 866-436-0457. You want to make sure that you include the following information: the subject of the fraud, waste, and abuse, his or her ID information, what happened, so what is that fraud, waste, or abuse, and any other important information that you can provide. So what happens? How can we protect those who report fraud, waste, and abuse? Whistleblowers are offered protection against retaliation under the False Claims Act. Employees discharged, demoted, harassed, or otherwise discriminated for reporting fraud, waste, and abuse, or as a consequence of whistleblowing, entitled to relief necessary to make employee whole. Conclusion. The training today has given you knowledge about what fraud, waste, and abuse is and why it's important to identify cases of fraud, waste, and abuse, the tools necessary to feel confident in reporting fraud, waste, and abuse without fear of reprisal, understanding why MTM requires training, knowledge that everyone is responsible for fraud, waste, and abuse, and knowledge that preventing fraud, waste, and abuse is critical. Stop it before it happens. Moving on to HIPAA, or our Health Insurance Portability and Accountability Act. This training will provide information necessary to ensure member health information is regarded with privacy and security. Provide information necessary to meet standards for privacy and security set forth by governing agencies. Focus on daily functions of transportation providers to ensure member privacy and security. To give you a little bit of background as far as HIPAA goes, it was passed by Congress in 1996. The Department of Health and Human Services, or HHS, implemented final privacy rule on April 14, 2003. Compliance date for security standards was April 20th, 2005. In 2009, we had the HITECH Act that widened scope of privacy and security protections available under HIPAA. The HIPAA privacy rule, it ensures nationwide uniform procedural protection for all health information. It imposes restrictions on use and disclosure of protected health information, or PHI. It gives people greater access to medical records and provides people with more control over their health information. The security rule, or the privacy rule, deals with PHI in general. The security rules deals with electronic PHI, or ePHI. The security rule for ePHI greatly expanded in 2009 under American Recovery and Reinvestment Act. The HITECH Act, that's of 2009, the American Recovery Reinvestment Act of 2009, imposes new obligations on a covered entity, or a CE, and business associate, or BA. It includes breach notification, BA directly responsible for compliance with security rule, and the BA liable for violations of security and breaches. The HIPAA expectations include the use or disclose of PHI only for work-related purposes, limited use and disclosure of minimum necessary to accomplish intended purpose of use, disclosure, or request, exercise reasonable caution to protect PHI under your control, and understand and follow MTM privacy policies. Report privacy problems to supervisor and MTM as soon as possible. PHI is individually identifiable health information that is transmitted by electronic media, maintained in electronic media, or transmitted and maintained in any other form or medium. When MTM member, agency, or health provider gives personal information to MTM, that information becomes PHI. Member name or address, Social Security number or other ID number, Medicaid or Medicare number, physician's notes, or billing information. Use or disclosure of PHI. The privacy rule covers use and disclosure of PHI and is designed to minimize careless or unethical disclosure. PHI can be used or disclosed, PHI cannot be used or disclosed unless it is permitted or required by the privacy rule. Use versus disclosure. PHI is used when it is shared, examined, applied, or analyzed. PHI is disclosed when it is released or transferred, accessed in any way by anyone outside the entity holding the information. PHI may be shared when it's for the TPO, treatment, payment, or healthcare operations. So treatment would be management of healthcare and related services that includes coordination among healthcare providers. Payment, which is various activities of healthcare providers to obtain payment or reimbursement for services. Healthcare operations, so certain administrative, financial, legal, and quality improvement activities of covered entity necessary to run its business and to support core functions of treatment and payment. Use or disclosure of PHI. Transportation companies permitted to use or disclose PHI for scheduling trip information, confirming special needs or adaptive equipment, and incidental use such as talking to a facility or medical provider. Minimum necessary. Use or disclosure of PHI should be limited to minimum amount of health-related information necessary to accomplish intended purpose or use of disclosure. MTM has developed policies and procedures to make sure you have the least amount of PHI is shared. If you have no need to review PHI, then stop. When maintaining privacy regarding written PHI, you want to keep information in a folder during business hours and locked drawer after hours. Shred any documents containing PHI after use. Keep the minimal amount of information in a hard copy format. Do not leave any documents unattended, whether it's at the printer or copy machine. Regarding the telephone, when you call, if you have to leave a message, leave minimal information necessary when you're confirming trips or ask the member to return your call. When you fax, you always want to use a cover sheet. That cover sheet should state that this is confidential information. It should give a contact if the fax is received in error and spells out HIPAA language. You'll see a confidentiality statement down at the bottom of our example over on the right-hand side. You also want to make sure that you're verifying fax numbers before you send anything that contains PHI. When emailing, emails that contain PHI must be sent securely. You must follow all directions for secured email, and you don't want to enter any sort of PHI in the subject line. So that, again, remember back to our examples, name, phone number, address. If you have to send that to an email or send it in an email, you want to make sure that you send it secure. Workstation and vehicle. You always lock access to computer with a password and privacy notice when you're not on your computer. You want to remove documents containing PHI from copiers and printers as soon as possible. You want to keep PHI information in a folder or upside down during work hours when you're right there next to it. Remove PHI from desk or vehicle and place in a locked drawer at the end of the day or if you're not currently using it. And do not discuss PHI in public areas. You want to verify, identify, and you want to transmit PHI by telephone only when it can be overheard, cannot be overheard. When leaving messages, limit information left to member's name, a request to return call, and your name and telephone number. What happens if there's a misuse of PHI? It can result in civil and criminal sanctions, including for civil penalties up to $25,000 a year for inadvertent violations, $250,000 for willful neglect, $1.5 million for repeated or uncorrected violations. For criminal penalties, up to $250,000 fine and prison sentence for up to 10 years for deliberate violations. Misuse can also result in sanctions by DHHS and other penalties related to not meeting contractual obligations. A couple of examples for you of misuses of PHI. A South Dakota medical student took home copies of 125 patients' psychiatric records to work on a research project. He disposed of the material in a dumpster at a fast food restaurant where they were found by a newspaper reporter. In Florida, several hundred hospital workers browsed records of famous patients who recently came to the facility, even though few of the workers were involved in the case. Reporting misuse of PHI. Report incidents of accidental or incidental or intentional disclosure to your supervisor and to MTM. No adverse action will be taken against anyone who reports in good faith violations or threatened violations of privacy rule, security rule, or related policies. MTM must report to DHS all uses or disclosures not permitted by BA provisions of contract or HIPAA. Breach of ePHI. HITECH Act imposes data breach notifications requirements for unauthorized uses or disclosures of secured encrypted PHI. Breach is unauthorized acquisition, access, use, or disclosure of PHI which compromises the security or the privacy of the information. Examples of breach ePHI include theft of 57 hard drives at an insurance company's training facility, including images from computer screens containing data that was encoded but not encrypted. Theft of laptop containing PHI that was password protected but not encrypted. Breach notifications. Notice to individual of breach of his or her PHI is required under the ARRA HITECH Act. Breaches involving PHI of more than 500 people in one circumstance must be immediately reported to DHHS by covered entity and will be posted on DHHS's site. Business associates must report security breaches to covered entities. Enforcement of privacy and security. Office of Civil Rights has enforced privacy rules since 2003. CMS has enforced security rules since 2005. As of July 27, 2009, DHHS has delegated enforcement of both rules to Office of Civil Rights. We've got a few resources here for you regarding HIPAA. We've got the CMS, Office of Civil Rights, and the USDHHS. Our glossary here for HIPAA, we've got our business associate, and that is a person or entity that performs certain functions or activities that involve, use, or disclose of PHI on behalf of or provide service to a covered entity, protected health information, individually identifiable health information, minimum necessary information. That's current practice is that PHI should not be used or disclosed when not necessary to satisfy a purpose or to carry out a function.